Hello and welcome. Today we're diving into a complex and often misunderstood condition, lupus cerebritis. This neurological manifestation of systemic lupus erythematosus, or SLE, can significantly impact a person's life. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. The exact cause of lupus cerebritis remains a puzzle, though we understand it stems from systemic lupus erythematosus. SLE is an autoimmune disease, meaning the body's immune system mistakenly attacks its own tissues and organs. In lupus cerebritis, this autoimmune attack targets the brain and central nervous system. Genetics, environmental factors like viral infections or exposure to certain toxins, and even hormonal imbalances can play a role in triggering SLE and subsequently lupus cerebritis. However, it's crucial to remember that not everyone with SLE will develop neurological complications. The pathophysiology of lupus cerebritis is intricate. Essentially, the autoimmune response in SLE leads to inflammation and damage within the brain. This can manifest in several ways. Antibodies, the immune system's attack force, can directly target brain cells or blood vessels supplying the brain. This can lead to vasculitis, inflammation of the blood vessels, which restricts blood flow and deprives brain tissue of oxygen and nutrients. Additionally, inflammatory molecules called cytokines are released, further contributing to brain inflammation and damage. These processes disrupt normal brain function, leading to a wide range of neurological and psychiatric symptoms. Determining the exact number of people affected by lupus cerebritis is challenging. Because symptoms vary and diagnosis can be complex, its prevalence is often underestimated. Studies suggest that neurological or psychiatric manifestations of SLE, including lupus cerebritis, can occur in anywhere from 20% to over 80% of individuals with SLE. This wide range reflects differences in study populations, diagnostic criteria, and the severity of the underlying lupus. It's important to understand that lupus cerebritis is a significant contributor to the overall burden of SLE. The signs and symptoms of lupus cerebritis are diverse and can be quite variable from person to person. They can range from mild cognitive difficulties to more severe neurological problems. Common symptoms include headaches, seizures, mood disorders such as depression and anxiety, psychosis, cognitive dysfunction affecting memory and concentration, movement disorders, and even stroke-like symptoms. Because many of these symptoms can overlap with other conditions, diagnosis can be challenging. It's important for individuals with SLE to report any new or worsening neurological symptoms to their physician promptly. Diagnosing lupus cerebritis requires a comprehensive approach. There's no single definitive test. Doctors typically rely on a combination of factors, including a thorough medical history, neurological examination, blood tests to assess lupus activity, and look for specific antibodies, and neuroimaging studies like MRI of the brain to detect inflammation or structural changes. A lumbar puncture or spinal tap may also be performed to analyze the cerebrospinal fluid for signs of inflammation or infection. Ruling out other potential causes of neurological symptoms, such as infections or other autoimmune disorders, is also essential for accurate diagnosis. While there aren't distinct classifications or types of lupus cerebritis in the traditional sense, the condition can manifest with different predominant symptom profiles. Some individuals may experience primarily cognitive dysfunction, while others may have more prominent psychiatric symptoms or seizures. These varied presentations likely reflect differences in the specific areas of the brain affected and the underlying pathological mechanisms involved. This variability underscores the importance of personalized treatment approaches tailored to the individual's specific symptom profile. The treatment and management of lupus cerebritis aims to reduce inflammation, control the underlying autoimmune response, and manage individual symptoms. Immunosuppressant medications, such as corticosteroids, cyclophosphamide, and mycophenolate mofetil, are often used to suppress the immune system and reduce inflammation. Antimalarial drugs like hydroxychloroquine, commonly used in SLE, can also have a neuroprotective effect. In addition to these medications, symptomatic treatments like anticonvulsants for seizures, antidepressants or antipsychotics for mood disorders, and pain relievers for headaches may be necessary. Physical therapy, occupational therapy, and cognitive rehabilitation can also play an important role in helping individuals regain function and improve their quality of life. Currently, there's no known way to completely prevent lupus cerebritis in individuals with SLE. However, managing the underlying lupus effectively can potentially reduce the risk of neurological complications. This involves adhering to prescribed medications, attending regular follow-up appointments with a rheumatologist, and adopting healthy lifestyle habits such as getting enough rest, managing stress, and avoiding known triggers of lupus flares. Early recognition and prompt treatment of any neurological symptoms are also crucial to minimize potential long-term damage. The prognosis for lupus cerebritis varies depending on the severity of the condition, the extent of brain damage, and the individual's response to treatment. Early diagnosis and aggressive treatment can significantly improve outcomes. Some individuals may experience complete or near-complete recovery, while others may have persistent neurological deficits. Ongoing research is focused on identifying biomarkers that can predict the development of lupus cerebritis, developing more targeted therapies, and understanding the long-term effects of the condition on brain health. Novel therapies targeting specific inflammatory pathways or immune cells are also being investigated, offering hope for improved treatment options in the future.